Aloha, this is Jamel here in Honolulu, Hawaii. Again, thank you guys for tuning into my video blog, sharehospice.com. So today's topic is all about what is POLST and is POLST for everyone, or do I need one? So POLST here in the state of Hawaii basically means provider order for life-sustaining treatment. It is basically your medical care choices and your wishes that's carried through your doctor's order. Again, this is a medical order that you and your physician have come up with, and here in the state of Hawaii it's actually a green form that you've made some medical decisions about what you want and what medical care you want, and also what medical care you do not want. So again, this is followed by the healthcare providers here in the state of Hawaii, such as other physicians, nurses, the paramedics, and even the EMT. And is POLST for everyone? Definitely not. So the POLST was basically meant for patients and individuals who basically have a serious illness, maybe an advanced disease, that at that time they just felt like it's no point for them to be maybe fully revived. They do not want resuscitation. Maybe they don't want artificial hydration or nutrition. They don't want to be in a vent or tube or being on a machine to be able to live. So these are some of the things that you'll have to discuss with your physicians about what medical care you want and what medical care you do not want. So however, if you do, for a lot of people, sometimes when they're faced with this form, sometimes they see the word do not resuscitate. So even with checking the box do not resuscitate does not mean that that patient or that individual will not be treated. Do not resuscitate basically means your heart stopped, and at that time you've chosen not to be revived. However, it does not mean that you don't want to be comfortable. So that's why there's other options there that talks about having comfort measures only, limited interventions, or having full code. So it can be very personalized and based on your values and your culture, what's going to be important to you. So here in the state of Hawaii, it is a green form. It must be signed by your primary care doctor or a nurse practitioner alongside with your signature, and if not your signature, at least your designated health power of attorney. So hopefully this helps you guys understand a little bit about the POLST. Again, stands for Provider Order for Life-Sustaining Treatment. It's definitely not needed for everyone or every person here in the state of Hawaii. It's typically, again, meant for only patients and individuals who have an advanced disease or illness. So again, this is Jamel from Honolulu, Hawaii. Hopefully you learned a little bit more about POLST and a little bit more about me. And anyways, have a great evening. Aloha.